Hi, I'm Dr. Kosembevsky here at the Osteopathic Center, and I just want to talk about what you can expect when you come in for an appointment with us. So, the very first thing you're going to do is contact us either by phone or through our website, and you'll submit a request to make an appointment with us. And of course, we always do our best to get you scheduled at the earliest opportunity possible that fits both your schedule and our availability. And then, as soon as we have you on our schedule, what we're going to do is send you a link to sign up for our patient portal. And when you sign in there, you'll get a notification that you have a whole bunch of forms to do. And we're sorry, we know it's a lot of forms, but these forms are actually really helpful for us to prepare for your video or for your appointment. They'll go over basically your past medical history, any medicines you've taken, things you've tried, like going to see a chiropractor, seeing a physical therapist, whatever you've done, so that by the time you get to us, I've already reviewed these forms, or one of the other doctors here, whoever you're seeing, has already reviewed your forms, and they will have a prime knowledge of what to do with you. And the other thing is, we always ask, what are you coming in for? Shoulder, hip, knee, whatever your issue is. And that just gives an idea of how to prepare for your visit. So when you come in here, we'll bring you in, we'll take your vitals, and you'll talk to myself or whichever doctor you're seeing. And so we'll have a talk. The first thing, and this is my personal approach to it, is at first we'll talk about what happened. You know, did you fall? Did you have an accident? Were you in the gym? Whatever you did to injure yourself. Or maybe you're not coming in for an injury, or maybe you're coming in for IV treatment. So we'll talk about what you're looking for and what you're hoping to accomplish, and any other goals you may have in mind. And then from there, we'll talk about your history. I know that you just put them on the forms, but now I want to hear it from your own words, because maybe something will spike up. Let's say you're coming in for back pain and you don't you forgot to put on the form, but 10 years ago you fell off a ladder and you were fine, you walked away and you didn't think anything of it, but 8 years ago you started having back pain. So maybe that fall off the ladder contributed to your pain. Or maybe you're just feeling sick and you're looking for IV therapy and you want to know what will make you better. And it's really important to me to know your medical history and know how long you've been sick. So we'll talk for a bit, and then from there, if you're coming for IV therapy, we'll get you ready to have an IV. If you're coming in for manipulation, we will get you ready to have manipulation. Or if you're coming in for regenerative medicine injections, we'll move on to a physical exam where we'll do some muscle testing, we'll poke and prod you. I'll poke you and does it hurt here, does it hurt there? Because all that gives me a really good idea. If something's not injured, it shouldn't hurt when I poke it. But if it is injured, it will hurt. And that's what I'm looking for, is those sources of pain. And then we'll talk about what we can do to treat your pain. And, sometimes we'll talk about how many injections you need. And sometimes it ends up being a lot of injections, like 8 to 10 injections. And I'll explain to you, and I like to educate my patients about why we need this many, and that we need to stabilize the area, not just fix where you're directly feeling the pain, but other contributors to the pain. We'll talk about imaging. Some patients have imaging ready to go, and that's great. That's extremely helpful. Some patients don't want to get imaging for whatever reason. They're scared to go on an MRI. They have claustrophobia, whatever it is. So we can talk about how necessary imaging is. Imaging is always extremely helpful, but it's not always mandatory to have to inject. It depends on what the issue is. If it's very simple, like you pulled your finger and now it's been hurting for 3 weeks, we don't necessarily have to image your finger. We may be able to just inject it. So we'll talk about that. We'll talk about how and why and where you need the injections, and we'll talk about the different types of injections that we offer here. Prolotherapy versus platelet-rich plasma versus mesenchymal signaling cells, colloquially known as stem cells. And then from there, if we need to inject, we'll inject. And then we'll talk about what to expect afterwards and how often we see you. If we always like to do a follow-up, but we'll talk about possibility needs for more injections. We'll talk about how you need to go to physical therapy and what you can expect after. Thank you.